Breakaway bases are key safety equipment in baseball and softball, along with many other improvements in sports safety. Injuries can still occur, especially with sliding. Again, the basics of every assessment start the same: scene safety or approval from the officials to enter the space, and then asking questions of the athlete to see what happened, where the pain is, and getting a sense of the injury. Removal of the shoe is often a discussion during events like this. This is something we will tackle in the live session, as there is not one right answer. Again, decisions need to be made about when and how to move an athlete versus addressing the injury in place. In this case, the splinting is done right on the field. The sports PT is using a SAM splint, molding it in the shape of a posterior splint, and securing it with cravats or triangular bandages. Again, keep the tension of the ties off of the area of injury. Notice how she shimmies the tie under the SAM splint to slide it in the correct place and not move the leg and ankle unnecessarily. Remember, checking pulse and sensation before and after is necessary. If a rigid splint is not available, a soft splint may offer enough comfort to move the athlete and then get definitive care. A blanket or pillow can be wrapped around and secured to the ankle for protection and to limit movement. Checking sensation and movement can be a challenge, so ask the athlete to wiggle toes. There are multiple items to use as splints. Here, our sports PT is demonstrating the use of rigid splints. Again, the soft padded side goes against the athlete. The splints are secured with available material, here again triangular bandages. When securing the splint, avoid the injured site. Just as we showed for the upper extremity, vacuum splints work well for lower extremity injuries. The process is the same. Secure the splint with the straps, and then remove the air from the splint with the hand pump. The straps are again adjusted. In each of these cases, the sports PT needs to think about how to move the athlete off the venue. Cart, carry, two-person assist. These will depend on the pain and how the athlete feels, as well as available resources.